I felt so tired. I was getting so much sleep, but I couldn't get off the couch at the end of the day. I cried all the time. After finally talking to my doctor, I started to feel like myself again. Medication helped me get moving, and then I was able to get therapy to help treat my depression.
I realized I'd been snapping at my wife constantly, and it was over nothing, cooking a meal or cleaning the kitchen. I was so irritable. I didn't know that irritability was such a clear sign I had depression. I got help and things changed for me. I was able to get my temper in check, think more clearly, and start working with a therapist.
These are the voices of people who have experienced the benefits of medical support as part of their treatment for depression. Prescription antidepressant medication is one of the most common treatments for both depression and anxiety, and when used in conjunction with an evidence-based therapy for depression, it is very effective. The most common medical prescriptions for depression are selective serotonin reuptake inhibitors, or SSRIs, and serotonin and norepinephrine reuptake inhibitors, or SNRIs. Serotonin and norepinephrine are two of the many neurotransmitters in the brain thought to have an effect on our mood. SSRIs and SNRIs are most effective for people who are experiencing moderate or severe depression. People usually begin to feel the main effect of the medication after about 2 to 4 weeks, when symptoms like fatigue, lethargy, disturbed sleep, irritability, agitation, and poor concentration begin to improve. People talk about feeling more like themselves and say they start to enjoy their relationships and activities again. This is especially true after the full effect of the medication is felt about 6 to 8 weeks after starting treatment. This pattern of improvement over time is common, especially when people take the right dose at the same time each day and don't use alcohol and other drugs at the same time. SSRIs and SNRIs are not addictive and do not produce a high. Most side effects are mild, happen in the first several weeks of starting the medication, and disappear very quickly. As with any medication, some side effects of SSRIs and SNRIs might last longer than the first few weeks, including sexual side effects, such as difficulty in achieving orgasm or an erection. It's important to remember there are several different types of these medications, and your provider can help find the correct dose and type of medication. Having candid conversations with your provider can help eliminate most or all side effects. Some prescription antidepressant medications include a warning about the possible increase in risk of suicidal thoughts and behavior at the start of treatment. One reason for this may be that people beginning treatment are often experiencing their worst symptoms of depression, including feelings of hopelessness, worthlessness, and even suicidal thoughts. It's always important to seek and provide support for anyone beginning antidepressant medication. And if there is a crisis, the National Suicide Prevention Lifeline can assist anyone at any time. A treatment plan for moderate or severe depression that includes antidepressant medications is one of the most reliable ways to manage it. When used in conjunction with cognitive behavioral therapy, most people find their depression can be treated very effectively. The symptoms of depression can be overwhelming. With the right medication, symptoms can be managed, reduced, and even eliminated. And with that relief comes the most important change of all. People can feel hope again.